Assalamu alaikum. Dear student, I am Dr. Anisa Sadiq, Senior Registrar Gynae. Today, the lecture will be on hormonal control of the menstrual cycle. Dear student, I am recording this lecture again for you people. I think previously it was sent wrong, and there was also, I think, some voice problem in the previous lecture. So the today lecture will be on hormonal control of the normal menstrual cycle. In other words, it is about the physiology of the normal menstrual cycle. Dear student, the learning objective of this lecture will be that at the end of the lecture, you people should know that what is normal menstrual cycle, and you people should understand the physiology of the normal menstrual cycle and describe the changes that occur during different phases of the menstrual cycle. Now, what is normal menstrual cycle? What is the definition of normal menstrual cycle? It is periodic discharge of blood and cellular debris from female genital tract. And in other words, it is cyclical changes from one menstruation to the next menstruation in a cyclical pattern. So it is called menstrual cycle because it is repeated in a cyclical fashion. The duration of menstrual cycle is 28 days and plus minus 4 days. It varies in length in different ladies. There are some terms related to the normal menstrual cycle. Menstruation usually start at an average age of 13, and the first menstrual cycle is called menarche. When the first menstrual cycle started, then it is called menarche, and last on an average age of 51, which is called menopause. Menopause is permanent cessation of the menstruation in a female. So it is called menopause. And this normal menstruation, it is a high complex interaction between the number of hormone, and these hormones are produced by three organs of the body: hypothalamus, pituitary, and ovary. And the interaction between these three organs is called, which is controlling the normal menstrual cycle, it is called hypothalamic pituitary ovarian axis. Now, certain terms which are related to the normal menstrual cycle. What is normal duration? It is mean duration is 28 days and ranges from 21, and in some book it is mentioned 18 to 35, in some it is 21 to 35. So the average range is about 21 to 36 days. And what is the average duration of menses? In most of the female, it lasts for 3 to 7 days. It can last up to 10 days in some female. And what is normal estimation blood loss? Normal estimated blood loss, it also varies ladies in different female. The range is about 20 to 80 ml. When it is less than 20 ml, then it is called oligomenorrhea or scanty menses, or when it is more than 80 ml, then it is called menorrhagia. When does evolution occur? These are certain terms which are important. Evolution usually occur on day 14 of the menstrual cycle and 10 to 12 hours after the onset of the mid-cycle age surge. How many women have menstrual cycle with their lifetime? Every woman have approximately 300 to 400 cycle in their lifetime span. And how many oocytes are present at birth? when a baby is born, female baby is born, there are how many oocytes are present? About 2 million oocytes are present in the ovary when a female baby is born. Now, hypothalamic pituitary ovarian axis, it is very important because it is the axis which is controlling the whole changes in the menstrual cycle. This diagram showing in a very precisely the whole menstrual cycle. This is the hypothalamus. From the hypothalamus, the gonadotropin releasing hormone, it are released, and the hypothalamus pituitary hormone, it in turn control the pituitary gland, and this pituitary gland then releases, then it releases the gonadotrophic releasing hormone, gonadotropin, which are basically luteinizing hormone and the follicle stimulating hormone. These GnRH, gonadotropin releasing hormone, are releasing in a pulsatile patient. These LH, luteinizing hormone, and FSH, follicle stimulating hormone, which is releasing from the pituitary gland, are then act on the ovary. And from the ovary, different steroidal hormone are released. These are estrogen and progesterone. And these estrogen steroid hormone, estradiol and progesterone, then act on the reproductive tract, mean the uterus, and it is responsible for the menstruation. There are two roles of the ovary. Ovary performing two roles. One is production of the ova, mean gamete, and the second is production of the hormone, which is estrogen and progesterone. And these estrogen and progesterone are then responsible for the normal menstruation. Mean the menstruation is an external indicator of ovarian event controlled by the hypothalamic pituitary axis. Menstruation is basically the changes which occur in the ovaries and the endometrium. And these changes which is occurring in the ovary and endometrium, it is controlled by the hypothalamic pituitary ovarian axis. And this axis is responsible for the normal menstruation in the female. And this diagram very precisely explaining the normal menstrual cycle and the hypothalamic pituitary ovarian axis. From the hypothalamus, gonadotropin releasing hormone is released. It acts on the pituitary gland, and from here, luteinizing hormone and follicle stimulating hormone are released. And these luteinizing hormone and follicle stimulating hormone, which is called gonadotropin, these act on the ovaries, and the ovary is then ovaries. And different changes occur in the ovaries, and the ovary is then secreting steroid hormone, which is called estrogen and progesterone, and normal menstruation is then occur under the control of these hormones. This is also a diagram which is showing same hypothalamic pituitary ovarian axis, and in this the negative and positive feedback of the different hormone are explained, but this diagram is not very clear. So the previous slide diagram and the previous slide was much better than this. Now, certain points about the hypothalamic pituitary ovarian axis. The first thing is that the hypothalamic pituitary ovarian axis, hypothalamic secrete the GnRH in pulsatile fashion and pulses, and these GnRH activity, it is only evident at puberty. When puberty started, the GnRH secretion in the hypothalamus start working. Follicular phase, GnRH pulses occur hourly. There are different phases which I am later on explaining to you people. Follicular phase and luteal phase in the ovary. Follicular phase, GnRH pulses occur hourly, and luteal phase pulses occur over every 90 minutes. Loss of pulsatility causes when pulsatility is lost, then there is down regulation of the pituitary receptor, release of gonadotrophin, down regulation, and then causes release of gonadotrophin releasing hormone. Release of gonadotrophin releases hormone is modulated by negative effect by steroid and gonadotrophin. And next is that normal cycle, normal menstrual cycle. The normal menstrual cycle, it is divided into two, ovarian cycle and endometrial cycle. And this ovarian cycle, it is further divided into follicular phase and luteal phase. And in the ovarian cycle, the third point is ovulation. First is follicular phase, then ovulation, and then luteal phase. And in the endometrium, which is endometrial cycle, which is also called uterine cycle, and it is also divided into proliferative phase, and the second is secretory phase. This proliferative phase is corresponding to the follicular phase of the ovarian cycle, and this luteal phase is corresponding to the secretory phase of the endometrial cycle. These both are going side by side. Ovarian cycle and endometrial cycle are going side by side. Okay. This is cycle, ovarian cycle before ovulation. The midpoint is ovulation. Before ovulation, there is follicular phase, and after ovulation, there is luteal phase. And in the uterine cycle, endometrium, there is proliferative phase and secretory phase. Mean pre-ovulation, there is follicular phase and proliferative phase, and post-ovulation, there is luteal phase and secretory phase. This is a diagram which is explaining in detail the changes which is occurring in the ovary, in the different hormone. These curves, these show changes which occur in the different hormone in the menstrual cycle and in the endometrium. This diagram explaining in detail the changes which is occurring in the menstrual cycle in the ovary, in the hormone, and in the endometrium. In the ovary. Now coming towards the ovary, these are certain other diagram which is also showing this the menstrual cycle. You people can see it in different books. And this diagram is very beautiful. This is showing normal menstrual cycle in detail. Now coming towards the ovary. This is the ovary, and these are the upward part of the diagram, upper part of the diagram showing different changes which is occurring in the ovary. When menarche is started, the primordial follicle, which containing the oocyte, and which you people have studied in detail in the embryology book, that the oocyte, it is arrested in the first prophase of the meiotic division. In the meiotic division, in the prophase stage, at menarche, it start activate and it start to activate and grow in a cyclical fashion, causing ovulation and fertilization. Fertilization. And if fertilization doesn't occur, then this end up in menstruation. And in the whole menstrual cycle, the ovary undergo three phases. The first is the follicular phase. Up till this is the follicular phase. Starting from this to this point, this is the follicular phase, and this point showing this that the follicle rupture and the oocyte is releases. This is the ovulation point, and after the ovulation, there is the luteal phase. The luteal phase. Okay, this point from this yellow one to this one is starting the luteal phase. Now coming towards the follicular phase. The initial phases, these first two phases are not under the control of hormone. When folliculogenesis, follicle development started, gradually it is controlling by the luteinizing hormone and the follicle stimulating hormone. But if with time the LH luteinizing hormone, FSH follicle stimulating hormone is not controlling this development, then all follicle, enteral follicle, which are present inside the ovary will undergo atresia, will be not developing, and so ovulation will be not occurring. Now, this diagram, this graph is showing this is this light is luteinizing the follicle stimulating hormone, and this dark one is the luteinizing hormone. So when folliculogenesis started, FSH level, the follicle stimulating hormone level rises in the first day of the menstrual cycle. Follicle stimulating hormone level rises in the first day of the menstrual cycle when estrogen, progesterone, and this is the first day of the menstrual cycle when estrogen, progesterone, and NHB level are low. This follicle containing two cell type, which is called containing two cell type. One is theca cell and the second is the granulosa cell. The theca cell corresponding are respond to the luteinizing hormone, and the granulosa cell respond to follicle stimulating hormone. And the theca, the luteinizing hormone, which is acting on the theca cell, the luteinizing hormone, which is acting on the theca cell, it will produce the androgen, and the androgen which is producing by the theca cell are then converted into the estrogen by the granulosa cell. An enzyme which is called 5-alpha reductase. This the androgen which is produces in the theca cell are converted into the estrogen by aromatization in the granulosa cell, and this occur under the influence of the follicle stimulating hormone. Sorry, not in the 5-alpha reductase, which is later on I will discuss you. This is occur under the influence of FSH, follicle stimulating hormone. The androgen is converted into the estrogen. As this follicle grow and estrogen secretion increases, there is negative feedback. When estrogen is secreted, estrogen secretion is increases, it give a negative feedback to the pituitary. When estrogen is increases, it presenting a negative feedback to the pituitary to decrease the FSH secretion, follicle stimulating hormone secretion. Remember it, when estrogen is increased, then FSH will be decreases. And this FSH, when decreases in the large number of follicle which are growing, there only one follicle reach to dominant follicle. That follicle will be reaching to dominant follicle, which has the most efficient aromatase activity and which has the highest concentration of LH, FSH induced LH receptor. That follicle will undergo ovulation, which has the highest aromatase activity and which has the highest number of LH receptor. The other follicle will undergo atresia. Besides LH and FSH, other autocrine and paracrine hormone also play a role in the follicular phase of the menstrual cycle. This is the from this point to this point is the follicular phase of the menstrual cycle, and these hormone include inhibin and activin. Inhibin, it is secreted by the granulosa cell within the ovary. Remember it. Inhibin is secreted by the granulosa cell within the ovary. It participates in feedback to the pituitary to down regulate the FSH release and also appear to enhance androgen synthesis. The second is activin. It is structurally similar to inhibin, but it has an opposite action. It is produced in the granulosa cell and in the pituitary, and it acts to increase FSH binding on the follicle. One is decreasing, down regulating, and one is activin is increasing the FSH receptor, and inhibin is increasing the FSH binding on the follicle. One thing is insulin-like growth factor. It also acts on as a paracrine regulator. Kis15 is another protein that have more recently found and have role in the hypothalamic pituitary ovarian axis. Now, when the dominant follicle is reached about 20 millimeter in diameter, then the follicular phase is about to finish by the end of the follicular phase, which lasts by an average of 14 days. From this point to this point, this lasts about 14 days. 14 days, and the Graafian follicle at the dominant follicle is an average size as about 20 millimeter. As the follicle mature, FSH induce LH receptor on the granulosa cell. Due signal for evolution, and the production of estrogen increases until it reaches the necessary threshold to exert a positive feedback effect on the hypothalamus and pituitary to cause the LH surge. And this LH surge occurs in 24 to 36 hours, during which time the LH induced luteinization of granulosa cell in the dominant follicle causes progesterone to produce. Progesterone starting producing in the granulosa cell, then adding further to the positive feedback for LH secretion and causing a small pre-ovulatory rise in FSH. Androgen, which is synthesized in the theca cell, androgen, which is synthesizes in the theca cell, also rise around the time of ovulation, and this is start to have an important role in stimulating libido, ensuring that sexual activity is likely to occur at the time of greatest fertility. The greatest fertility time is this time when ovulation is occur. Okay, the granulosa cell, which is producing androgen, occur during in highest concentration occur during the time of ovulation. The LH surge is one of the best predictor of the imminent ovulation, and this is the hormone detected in urine by our most over the counter ovulation predictor test. The LH surge has another function in stimulating the resumption of meiosis in the oocyte just prior to its release. The one function of the LH surge is to release the oocyte, and the second function is to resume the meiosis, which was arrested. Now it's assumed the meiosis before its release. The physical evolution of the oocyte occur after breakdown of the follicular wall take place under the influence of the LH, FSH, and proteolytic enzymes such as plasminogen activator and prostaglandin. So, people are advised who are seeking for fertility they don't use prostaglandin synthetase inhibitor such as aspirin and brufen, which may inhibit oocyte release. When the ovulation occurs and ovum is released, then the remaining follicle is converted into the corpus luteum. The granulosa cell, corpus luteum. The granulosa cell now have a reticulated appearance and it containing a yellow pigment. So it is called the yellow body. And this granulosa cell, the corpus luteum undergo vascularization, vascularization. And the mean by this vascularization is to produce steroid hormone, mean progesterone. And this production of progesterone is important because it stabilizes the progesterone which is released by the corpus luteum. It stabilizes the endometrium for preparation of pregnancy if fertilization occurs. Okay, and this high progesterone level also has a negative feedback effect on the FSH and LH, so that the further oocyte releases stop. The luteal phase. The luteal phase starting from this point to this point, it lasts for 14 days in the presence of beta human chorionic gonadotrophin, beta ICG, which is released by the implanting embryo. The corpus luteum will regress in the process known as luteolysis. Mean if fertilization occurs, this will provide continuous support to the pregnancy, but if pregnancy doesn't occur, this corpus luteum will undergo luteolysis and regress. And this, when later on disappear from the ovary, and the when this is disappear from the ovary, the progesterone support will be withdrawal, and the withdrawal effect on the uterus will causing shedding of this endometrium, and this menstruation will occur. Understand or not? When the corpus luteum undergo regression, then progesterone will be stopped. Mean progesterone will be withdrawal, and this withdrawal of progesterone causing the shedding of this endometrium, and it is visible as menstruation. And this will give a positive feedback to the GnRH and then LH and FSH, and again will the cycle will be started. Now coming towards, this was all about the follicular ovarian cycle, which is divided further. I am repeating for you people, which is divided into the follicular phase, ovulation, and then the luteal phase. And now coming towards the endometrial cycle. In the endometrium undergo two phases. One is proliferative phase. This one, this is the proliferative phase, and after ovulation, it is converted into the secretory phase. In the proliferative phase, the endometrium enter the proliferative phase after menstruation. जैसे menstruation शुरू हो जाती है, उसके बाद फौरन ही endometrium जो है ना proliferative phase में enter हो जाता है. The endometrium enter the proliferative phase after menstruation. In proliferative phase, the glands and the stroma undergo proliferation and start growth. The epithelium lining the endometrium changes from a single columnar epithelium to the pseudostratified epithelium, and multiple mitosis occur in these. And the endometrial thickness increases rapidly from 0.5 millimeter at menstruation. The endometrium may thicken at this point. When menstruation occurs, the endometrium thickness is only 0.5 millimeter. And in the proliferative phase, when proliferation begins, this reaches from 3.5 to 5 millimeter at the end of the proliferative phase. At the end of the proliferative phase, the endometrial thickening is about 3.5 to 5 millimeter. And when ovulation occurs and estrogen is stopped and progesterone secretion started, then the endometrium undergo secretory changes, secretory phase after ovulation. After ovulation, generally, which occur at about 14 days, there is a period of endometrial glandular secretory activity. Secretory activity occur in the endometrium. After LH surge, the the proliferation which was going on in the endometrium under the influence of the FSH now stop, and it undergo, and the endometrial thickness does not increase further. Endometrial thickness does not increase in the secretory phase, but the stroma and the gland in the endometrium undergo secretory changes. The gland become tortuous, the stroma become edematous, and spiral arteries undergo growth. And apical membrane atom, it is called pinopores. This is basically the apical membrane projection of the endometrium epithelial cells, and it occur after a day 21 to 22. And this pinopore, it basically progesterone induced, and it causes, and it preparing the endometrium for implantation. And the next is when secretory phase is over, then when the corpus luteum undergo regression and progesterone is withdrawn, then menstruation occur. Menstruation is usually the first day of the menstrual cycle, and there is shedding of the dead endometrium, dead endometrium, and menstruation ceases as menstruation stop when regeneration of the endometrium occur. With regeneration of the endometrium usually occur at day 5 to 6 of the cycle. Immediately prior to menstruation से थोड़ा सा पहले, there are three distinct layers of the endometrium is identified. One is the bacillus layer, which is bacillus layer. It comprises 25%. The middle one is the middle layer is called the stratum spongiosum with edematous stroma and exhausted glands. And the superficial layer, upper portion, the superficial layer, it comprises 25%, and it is the stratum compactum. And there is prominent decidualized stroma. There is prominent decidualized stroma. And as the circulating level of the estrogen and progesterone fall after 14 days of pollution, then a lot of lead to loss of tissue fluid, vasoconstriction of spiral arteriole, and distal ischemia. Distal ischemia occur, tissue fluid and vasoconstriction occur, and this result in tissue breakdown. When ischemia occurs, there is breakdown of the tissue and loss of the upper layer, along with bleeding from fragment of the remaining arteriole, seen as menstrual bleeding. Menstrual bleeding. When ischemia occurs, they lead to shedding of the endometrium. The effect of the estrogen and progesterone of the endometrium can be produced artificially by using oral contraceptive pill. These bleeding, vaginal bleeding will cease after 5 to 10 days as arteriole vasoconstrict and the endometrium begin to regenerate. When arteriole vasoconstrict and endometrium begin to regenerate, then the menses will be stopped. Hemostasis in the uterine endometrium is different from hemostasis in the elsewhere because the clot formation and fibrinolysis does not occur in the normal menstrual cycle. When menstruation occurs, then there is again endometrial repair and involve both glandular and stromal regeneration and angiogenesis to reconstitute the endometrial vasculature. And the vascular endothelial growth factor and fibroblast factor are found within the endometrium and both are powerful angiogenic agent and these are responsible again for the angiogenesis and for the growth. So this diagram was wholly explain the normal menstrual cycle. Whole you people will understand the normal menstrual cycle. Okay, this diagram explaining the follicular ovarian cycle, the endometrial cycle, the follicular phase, the luteal phase, the hormonal changes which occur during the menstrual cycle, and the endometrial cycle, the proliferative phase, and the secretory phase. Now, this diagram is also showing this. In this diagram, mostly the endometrial phases, endometrial cycle is explaining in detail. This is also the same. And this diagram is one thing I want to show it to you. When the proliferative phase, the endometrium is thick. Look at the proliferative phase. The endometrium is like this, increasing. And its thickness is increased. And the gland are histologically like this. And the uterus is appear like this. This is also the same in the luteal phase when the glands are tortuous, the glands are edematous, the arterioles are tortuous, then it's looking like this. Now, just a quick review, which I have explained. These slides are basically explaining the diagram, which I have explained to you people in detail. The follicular phase, which lasts for 14 days, FSH level rise in the first day of the menstrual cycle, when estrogen, progesterone, and inhibin level are low. I have already told these things in detail while explaining the diagram. Theca and granulosa Theca cell respond to LH, and granulosa cell respond to FSH. Inhibin activin also play a role in the follicular phase. Inhibin, it is increases the decreases the FSH level, and activin it increases the FSH level and produces both by the granulosa cell. Okay, evolution occur when there is LH surge, and during evolution the FSH in FSH which causes increased production of the estrogen, and the FSH during ovulation, the FSH level is decreases and estrogen level are at maximum, and this increased estrogen level causes release of egg, and ovulation occur 24 to 36 hours of the LH surge. LH surge is, as I have already told you, that it is one of the best predictor of the imminent evolution. And the second thing which occur due to LH surge is the resumption of the meiosis in the ovary prior to its release. LH surge, as I have already explained to you people, that one thing, the LH has two responsibility. One thing, it causes release of the ovum, and the second thing, it causes resumption of the meiosis in the oocyte. Now the luteal phase, it also lasts for 14 days, and in the luteal phase, there is continuous supply of progesterone, which is secreted by the corpus luteum, and this progesterone stabilizes the endometrium in preparation for pregnancy, and withdrawal of progesterone causes shedding of the endometrium. Reduction in the level of progesterone, estrogen, and inhibin give feedback to the pituitary, causing increased release of gonadotropin and cycling begin again. Mean when the luteal phase is finished and there is everything, progesterone also decreases, estrogen also decreases, and inhibin also decreases. These all things when decreases, they give a feedback to the pituitary gland to start production again of gonadotropin. And so the cycle is begin again. Now the endometrium, which I have already told you that endometrium undergo two type of changes. One is proliferative and the one is secretory change. And the proliferative phase started immediately after menstruation. In the proliferative phase, the endometrial gland, stroma, and the vasculature all are undergo proliferation. And the epithelium changes from single columnar epithelium to pseudostratified epithelium, and the endometrial thickness, which is at the time of menstruation it is 0.5 millimeter, and during the proliferative phase, it changes from 3.5 to 5 millimeter. And now the secretory phase, when ovulation occurs and the ovum is released, the endometrium, the corpus luteum, the follicle, sorry, the follicle, which changes to the corpus luteum, and the corpus luteum starts secretion of the progesterone. Under the influence of the progesterone, there is secretory changes in endometrium. The During the secretory phase, there is no further proliferation of the gland and stroma and arteriole. They are only become tortuous, they only become edematous, and fluid level is increased during the secretory phase. And spiral artery grow. Menopause. This is a term. This term is used, and this spinopod occur under the influence of progesterone. This spinopod is basically progesterone induced changes in the endometrium, basically apical projection of the endometrium epithelium into the cavity. And this causes, and this is making the endometrium receptive for the implantation. And this occur after day 21 to 22 of the menstrual cycle. Now, when the secretory phase is completed, then there is shedding of the dead endometrium, and it lasts for 5 to 6 days. I have already told you that just before menstruation, just before starting of the bleeding, shedding of the endometrium, three layers are identified in the endometrium. I have already explained to you people in detail. One was bacillus layer, one is spongiosum, and the third one is the compactum. And the spongiosum and the compactum layer are basically shedding during the menstruation, and the bacillus layer is not shedding. So this was all about the normal menstrual cycle and the physiology of the normal menstrual cycle. Hope you people have understand. You people can give feedback if you have any queries about this, and hope this lecture, this time lecture will lead to you people same, and you people take help from the for detail, and for you people look for the gynae book 10 teacher 20 edition, and for different picture and for diagrams, which is also right in detail in the embryology book and also in different internet websites. Thank you so much.